important nutrient our body needs is glucose, which is the important energy source of our cells obtained from the food we eat. Too much of glucose in the blood can lead to serious health consequences such as diabetes mellitus. Hello everyone. Watch this video to learn about what is diabetes mellitus, its prevalence, why we need to control it, some myths and facts, and adequate treatment to control diabetes mellitus. Do not forget to like and subscribe our channel. Diabetes mellitus is a chronic disorder that prevents the body to utilize glucose completely or partially. This can be due to failure in the formation of insulin or its liberation or action. Types of diabetes. Type 1 or insulin-dependent diabetes. Type 2 or insulin-resistant diabetes. And the other one is gestational diabetes that occurs during pregnancy. An estimated 463 million adults worldwide are living with diabetes currently, and it is projected to increase to 700 million by 2045. Every 8 seconds a person dies from diabetes. 4.2 million deaths in 2019 was due to diabetes and its complications. An alarming 1.1 million children and adolescents have type 1 diabetes, and 1 in 2 persons with diabetes are not even aware that they have diabetes, increasing the risk. World Diabetes Day is celebrated every year on November 14. International Diabetes Federation and World Health Organization established World Diabetes Day in 1991 to address the growing concerns about the increasing health threats posed by diabetes. The theme for World Diabetes Day 2020 is the nurse and the diabetes. The campaign aims to raise awareness around the crucial role of nurses which help people with diabetes manage their conditions. Currently, 59% of the healthcare professionals are nurses. 6 million more nurses are still needed worldwide. Myths and facts about diabetes mellitus. Myth number 1. Diabetes is a hereditary disease only. It is true that diabetes tends to run in families, but it is not the only factor that causes diabetes. Diet, lifestyle, age, acute stress are also the contributing factors leading to diabetes. Myth number 2. Type 2 diabetes is less deadly. No. In fact, if left unchecked, it can also cause serious complications and long-term consequences similar to type 1 diabetes. Myth number 3. Diabetic patients should avoid physical exercise. People think that physical exercise leads to weight loss. But with exercise, one may shed fat and gain muscle mass. Moreover, you can obtain important health benefits with regular physical exercise. Myth number 4. Diabetic patients have to follow special diet. People with diabetes benefit from the same healthy diet that is good for everyone else. They should just include plenty of whole grains, veggies and fruits in their diet, but limit trans, saturated fat and refined carbs. Myth number 5. Fruits can be consumed in unlimited quantities. Citrus fruits and apples can be taken, but banana and mango are high in fructose. When eaten in unlimited quantities, cholesterol levels may increase. Myth number 6. Sugar is to be totally avoided. In fact, if eaten as part of a healthy meal plan along with exercise, people with diabetes can eat sweets and desserts. The key to eating sweets is to have a small portion size of them. Myth number 7. Diabetic patient can eat wheat but not rice. This is not true. Both wheat and rice have same amount of carbohydrate that raise the blood sugar to a similar extent. Therefore, it should not matter whether one takes wheat or rice as long as the total quantity is restricted. Myth number 8. Diabetic patient can't eat starchy foods. Starchy foods can be a part of healthy meal plan, but portion size is the key. Whole grain breads, cereals, pasta, rice and starchy vegetables can be included as meals and snack. Last but not the least, myth number 9. Diabetes is a death sentence. Not true either. People with diabetes can live healthy lives free of complications. The management of diabetes is in your hands. Health workers can provide medications. However, it is the individual's responsibility to exercise and adhere to the diet. Why we need to control diabetes? To attain and maintain optimal metabolic outcomes, for optimal growth and development in patients with type 1 diabetes, to prevent and treat the chronic complications of diabetes as older people with pre-existing medical conditions appear to be more vulnerable to becoming severely ill with diseases such as COVID-19, complications of diabetes. It is found that adults with diabetes have a 2 to 3-fold increased risk of heart attacks and strokes. Combined with reduced blood flow, neuropathy in the feet increases the chances of foot ulcers, infection, and eventually need for limb amputation. Diabetes is the cause of 2.6% of global blindness. Diabetes is among the leading cause of kidney failure. Treatment and management of diabetes mellitus. Diabetes can be treated and managed by improving diet, exercising regularly and maintaining healthy weight, medications to control body's normal blood glucose level. However, self-management through lifestyle plays a very important role in it. Since dietary measures are an essential part of treatment of diabetic patients, consulting a dietitian is better to understand your nutritional requirements and maintaining a healthy body weight even if you are on medication. Maintaining a healthy and balanced diet is crucial in managing diabetes. Eat a healthy diet full of vegetables, fruits, whole grains and high fiber foods. Reduce and limit the consumption of sugars and fatty foods. Insulin is the most common injectable medication used to treat diabetes. There are two types of insulin, long-acting or basal insulin which lasts for 24 hours, and the other one is short-acting or mealtime insulin which acts for 6 to 8 hours. An insulin pump can be used to deliver insulin. Develop a self-management plan by consulting your doctor, dietitian, or any other health professional. Self-management plan should include a healthy diet, regular moderate intensity exercise, strategies to reduce stress, ensuring adequate sleep, and managing depression if present.